you, your family, your friends, the faculty. Now, in preparing for today's remarks, I received a lot of great advice about what to share for today. Don't talk about COVID. Do talk about COVID. That's right, I heard it. Talk about the CDC. Don't talk about the CDC. Look forward, look back. Talk about your experience. Make it about their experience. Wait, but above all, be inspirational. All right, I'll try for that. While I do hope to inspire you today, you have already inspired me, and it shaped the focus of my remarks today. It's the Wake Forest motto that you already heard, pro humanitate, for humanity. And what I love most about the motto is that it feels very much alive on this campus. So before I share my words, I want to share some of your words. These are just a few ways in which the Wake Forest University students describe what pro humanitate means to them, pulled, of course, from Instagram. It's about openness to exploration and willingness to step out of your comfort zone. It means learning about who the other person in front of us is, or beside us, or behind us. It means being in community with people, thinking about what people need, and creating the ideas and the answers to meet those needs. Those are powerful words to live by. But look, let's be real. That's not always easy to actually do. It can be really, really hard to live pro humanitate. We see evidence of that all over the world right now. Having good intentions doesn't mean much without action. To bring this home, I'm going to tell you a story about a time when I failed. A time that I had the right intentions, but my actions and the system I worked in didn't hit the mark. I didn't do a good enough job learning about the person in front of me. It's a story about a patient I met when I was nearly done with my training as a primary care physician at Massachusetts General Hospital in Boston. For today, let's call my patient Jennifer. Jennifer was a full-time grad student, just like some of you here today. She came in because she was losing her hair and feeling tired. Pretty standard. My mind immediately sprung to the possible causes: a thyroid issue, or maybe anemia, low blood counts. Maybe she had some sort of autoimmune disease that was flaring up for the first time. I asked her a couple of very personal questions, the standard, medical questions, about things like the menstrual cycle and her family history of disease. Yep, I said menstrual at graduation, yep. I did a quick exam, and then I did what I did best. I ordered blood tests to try to get to the bottom of it. When all the tests came back normal, I spoke to her on the phone, and she told me she thought she had lost some weight, and maybe her stomach felt bloated. Aha, okay, I know how to investigate that. I ordered a CAT scan of her abdomen. That also came back normal. Now, about 8 weeks had passed, and she was back in my office, and I'm stumped. I asked my supervising doctor, because I was still a trainee, for advice. I showed her all of Jennifer's lab tests, and we were discussing which specialist should we send Jennifer to next. And about that time, my nurse tech, let's call him John, came over. John had checked Jennifer in and taken her blood pressure and her weight and such, and he said to me, "I think you should ask your patient if she has enough to eat." I think you should ask your patient if she has enough to eat. I had an out-of-body experience, and actually at first I was super defensive. In my mind, I was thinking, no, she isn't hungry. She's a grad student. She has insurance. She has cute clothes. Then I was horrified. I didn't ask Jennifer about a fundamental core aspect of her health, whether or not she had enough to eat. So I pulled it back together, I went into the room, and I asked the hard questions, but more importantly, I listened. Jennifer was living out of her car because she had left a relationship that suddenly turned abusive. And she didn't want to tell her family or friends about it because she was ashamed. Now, once I understood the core issue, we were able to get Jennifer connected to the resources to help her. But for 8 weeks, Jennifer had gone on being hungry and in unstable housing because of me. Now, my intentions from the outset here were good. I wanted to help Jennifer. I wanted her to be healthy. I wanted her to thrive at school. I also think I'm a pretty smart person. You heard, I certainly got a very pricey education. But what if I had fully understood that my experience was not her experience? I might not have created a story of who she was based on her cute clothes and her status as a student. And importantly, the system I worked in made it super easy for me to miss the person in front of me. It was really easy to spend money on the wrong things, ordering blood tests, CAT scans. But it actually was really hard to connect her to the housing, counseling, and food resources that she really needed to keep her healthy and thriving. Now, I share the story with you today because it's become fundamental to who I am and how I show up both professionally and in my personal life.